Case study number 6. Summary. James Thompson, a 45-year-old male. James presents with a persistent cough, night sweats, and unintentional weight loss. He has a history of smoking and a chronic cough. Current situation. James arrives at the clinic with a persistent cough that has lasted for more than 3 weeks, night sweats, and a recent unintentional weight loss of 10 pounds over the past 2 months. His vital signs are: blood pressure 130/85 of a millimeter of mercury, heart rate 95 bpm, respiratory rate 22 breaths per minute, temperature 37.8 degrees Celsius 100.0 degrees Fahrenheit, oxygen saturation 96%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Tuberculosis TB. TB is a bacterial infection caused by Mycobacterium tuberculosis. Pathophysiology involves the inhalation of airborne droplets, leading to primary infection in the lungs and potential spread to other organs. Key points include the importance of early detection and isolation to prevent transmission, and the need for prolonged antibiotic therapy. Answer B. Lung cancer. Lung cancer is a malignancy that originates in the lungs, often associated with smoking. Pathophysiology includes the uncontrolled growth of abnormal cells, leading to tumor formation and potential metastasis. Important considerations include early detection, staging, and appropriate treatment to improve outcomes. Question 2. What immediate nursing care is required for this patient? Answer A. For tuberculosis TB, initiate airborne precautions to prevent the spread of infection. Collect sputum samples for acid-fast bacilli AFB testing. Educate the patient on the importance of adhering to the full course of TB treatment and potential side effects of medications. Monitor for signs of respiratory distress and provide supportive care as needed. Answer B. For lung cancer, provide emotional support and education about the diagnostic process and potential treatments. Monitor respiratory status and manage symptoms such as cough and pain. Educate the patient on smoking cessation and provide resources for support. Coordinate with oncology for further evaluation and treatment planning. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. Chest X-ray. To identify any abnormalities in the lungs, such as lesions or masses. Sputum culture and sensitivity. To detect Mycobacterium tuberculosis or other pathogens. CT scan of the chest. For a detailed evaluation of lung structures and potential tumors. Bronchoscopy. To visualize the airways and obtain tissue samples for biopsy if a mass is detected. Complete blood count CBC. To assess for infection, anemia, or other abnormalities. Tuberculin skin test TST or interferon gamma release assays. To test for latent TB infection. Medication information. Anti-tubercular drugs, for example, isoniazid, rifampin, ethambutol, pyrazinamide. To treat active TB infection and prevent the development of drug-resistant strains. Considerations. Monitor liver function and educate the patient on the importance of adhering to the treatment regimen for the entire duration, usually 6 to 9 months. Side effects: hepatotoxicity, peripheral neuropathy, gastrointestinal upset. Contraindications: severe liver disease, allergy to any of the medications. Chemotherapy agents, for example, cisplatin, paclitaxel. For lung cancer, to reduce tumor size and slow the progression of cancer. Considerations: monitor for signs of bone marrow suppression, nephrotoxicity, and other chemotherapy-related side effects. Side effects: nausea, vomiting, hair loss, increased risk of infection. Contraindications: severe renal impairment, severe bone marrow suppression. Bronchodilators, for example, albuterol, to relieve bronchospasm and improve breathing. Considerations: monitor respiratory status and educate the patient on proper inhaler technique. Side effects: tremors, tachycardia, palpitations. Contraindications: hypersensitivity to the drug. Corticosteroids, for example, prednisone, to reduce inflammation and manage symptoms in lung cancer patients. Considerations: monitor for signs of infection and educate the patient on the importance of following the prescribed tapering schedule. Side effects: hyperglycemia, increased risk of infection, osteoporosis. Contraindications: systemic fungal infection, live virus vaccines.